Any patient who has not had standard of care genotyping of EGFR, ALK, and KRAS needs a new biopsy if they have non-squamous, non-small cell lung cancer. Certainly adenocarcinoma of any type, adenosquamous carcinoma is an adenocarcinoma, and those patients need genotyping. I do not routinely do an extra biopsy for a squamous cell carcinoma or for a neuroendocrine or carcinoid type tumor. That being said, in a never smoker, I will do a biopsy and genotyping for any genotype. Squamous cell cancer in a never smoker needs to be genotyped because it could be adenocarcinoma in disguise. Small cell lung cancer in a never smoker needs to be genotyped because we can find EGFR mutations. I just had a patient with a neuroendocrine carcinoma with mostly bone disease, and we did a biopsy and did next-gen sequencing and found a novel mutation that we'd not expected in a never smoker. So the people that, aside from primarily adenocarcinoma, that I pursue with greater vigor are patients who are never smokers and young individuals. And when I see someone who's under 40 years old with lung cancer, I think there's something weird about that kind of cancer, and we need to dig deeper and try to find something explaining why that happened. Now, in someone who has a smoking history, who has adenocarcinoma, and who's been tested for the standard things, that's a conversation we have then. And I'll say, well, look, our option's either standard chemotherapy, which doesn't work that well, or perhaps we should go for a biopsy. A biopsy means risk, perhaps, and risk of puncturing a lung, but it's something that I will often do for patients if we think it's right for them, but it's on a case-by-case basis. When I meet someone who has a lot of a smoking history, an extensive smoking history, who's getting kind of sick from their cancer, and they ask, I want a biopsy so I can test for BRAF, I'm reluctant to do a needle biopsy if the chance of finding a meaningful alteration is less than 1%. And even then, you might not be a candidate for a clinical trial or not. And it's a conversation to have, but there's a risk balance to have, a conversation to have there.